Hello, my friends, and how are you? No, really, how are you? It's a good question, right? Because today we're looking at the topic of health. We're going to look at some language, vocabulary, idioms, and pronunciation tips to help you talk confidently on this topic, all about health. Let's get straight into it. Hello, my name is Keith. And if you don't know me, I run a website called IELTS Speaking Success, helping you speak better English, give better answers, and get a higher score on the IELTS speaking test. Now, today we're looking at the topic of health, and it's a really important topic, right, for our lives, especially for IELTS students, because you have a lot of stress, a lot of pressure. It can be quite demotivating sometimes, and you need to keep your mental health strong all the way through. I recently had a student asking me about the leap from band 6 to band 7. She said she had been stuck at band 6 for several weeks and couldn't make up to a band 7. And I thought, wow, several weeks? That's nothing. You see, the gap between a band 6 and a band 7 usually takes people months and months, maybe up to a year. It's a big gap, much bigger than we think. So I was thinking how to help, and I said, there are two secrets to getting up from a 6 to a 7. One of them is practice, and the other is feedback. If you can get lots of practice in and get lots of feedback to show you where your mistakes are and how to improve, then with time, you will get up to the band 7 level. Now, you may know that I teach, I do give classes online, but you may also know my timetable is totally full for the next 2 months. So I have a solution for you. I've been looking at different platforms, and I found one that I really like, and it's called Cambly. Cambly is an online platform that has native speakers, and it allows you to go in and practice your English at the time you choose, the day you choose, and the frequency. It's a very flexible platform. You can sign up for a month to do classes, or 3 months, which might be ideal for your IELTS preparation. And you can go in there, choose your teacher, choose the time, practice anytime, anywhere. Really flexible and a great approach, I think, to help you practice questions and practice answers. Now, very kindly, the guys at Cambly, I spoke to them, and they have decided to sponsor this video, which means for you, you're going to get some discounts. How cool is that? So, first of all, they will give you, with the coupon code, and you get these in the show notes below, you can get 15 minutes free to try out the platform and to have a go. If you sign up for a month, then you can get 10% off. If you sign up for 3 months, you get a 24% discount. And if you go the whole hog, a full year, you get 42% discount. So it's worth looking at. I think it's a great way for you to practice and to get feedback so you can actually get better and better and get really well prepared for your IELTS test. Right now, we're going to move on and talk about health. Health is a really common topic in IELTS, not only in the writing, but also in the speaking. And I think any of the language you learn here today, a lot of it you could apply to the writing as well as the speaking, especially the ideas, right? So at the moment, there is a part 2 question that says, describe an article you read about healthy living. So for that part 2, well, you could be looking at, you could talk about an article in a magazine, in a blog, in a newsletter. It could be anywhere, even in a newspaper, and talk about what it says. The kind of things that are popular nowadays, right, are diets, losing weight. There's a lot of health advice about keeping fit, getting active, how to do different sports, walking and running, Cooking. There's a lot of health advice around homemade cooking. Superfoods. You know, these really, it's nonsense really, but it's a marketing ploy. Superfoods are these foods that have lots of extra antioxidants and vitamins, and they are really powerful nutrients for your body. Things like bananas, apples, what else? Blackberries, blueberries, strawberries. There's loads of them. And of course they're nutritious, but the notion of superfoods is a little bit of a marketing ploy. But those are things that you may be talking about. I'm going to look now today at part 3 questions, a bit more general, right? The kind of questions you may get are, how do people keep fit in your country? Do you think people take action on information they read about in health articles? Is it easier to live a healthy lifestyle compared to the past? Do you think health services should be free? How could health services in your country be improved? Brilliant. Remember, we never really know what questions we're going to get because the examiner will make up quite a lot of questions based on your answer. But these are some common questions that could come up and really interesting ones. Let's look at the ideas and let's focus a bit also on the type of question. Here, a lot of these are typical question types in part 3. For example, the first one, how do people blah, 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 right? Very common. We've seen this in previous videos. How do people keep fit in your country? Well, one way of thinking about this is to ask yourself, well, which people, right? People, it's a huge number of people. If we're talking about young people, oh, now there's a nice signpost. If we're talking about blah, then I think, if we're talking about old people, then I would say, if we're talking about women, I would say, if we're talking about middle-aged people, I think, right? So you could break down the people into different categories, right? How do people keep fit in your country? Well, if we're talking about parents, I would say a lot of parents like to take their children out into the park on the weekend and go for a stroll. They enjoy walking around the park, maybe at a leisurely pace. Sometimes the parents will go at a brisk pace, which apparently is better for your health. And I think they do it because it's a fun way to get fresh air, to be active, and also spend time with the family. I know, for instance, in England, many parks organise family activity days where you can go with the family and together with other families walk around the park for maybe 2 kilometres. And sometimes you even get a little medal or certificate at the end. So that's great. Things we could talk about, right? We talk about keeping fit, right? Improving your health, leading a healthy lifestyle. Now, the first step is to get fit or to get into shape. Get into, we connect, get into shape. People need to get into shape. It doesn't mean they become a circle or a square. No, it means they get fit, right? Get healthy. So people get into shape by doing something else. Now, once you're in shape, you have to maintain that level of fitness, right? So we talk about keeping fit, keeping healthy, keeping in shape. So it's maintaining that. So these are useful collocations for you, right? Good. How do we stay in shape? Well, some of the common activities, right? To go jogging, go swimming, go running, go go climbing. So you'll notice the go ing is a very common one. You can also say go for a jog, go for a run, go for a walk. For a becomes for a. Go for a walk. Stress on the last verb. Go for a walk. Go for a jog. Go for a stroll. Go for a climb. Go for a swim. Right? Different ways you can express it. With quite a few activities, especially yoga, karate, judo, we say to do, right? So it's very popular nowadays. People in England like to do yoga, or even to do Pilates. Pilates is very, very popular. I used to thought it was called pilots, and I thought it was only for the pilots in the air who fly the aeroplanes, a special activity for them. But apparently not. Pilates is an activity similar to yoga, I think, but more focused on your posture. Whereas I think yoga is more about your flexibility and your body and mind together. I think. I'm not a yoga guru, so I don't know. Although I have done a bit of yoga, right? I practiced yoga for a year or two when I was younger, but I've never done Pilates. So do with quite a few physical activities. What do people do in your country to keep fit? You could let me know. Write in the comments. Now, when you answer this question, be careful not to just give a long list, right? It's very tempting to say, how do people keep fit? Some people like to go jogging or maybe walking. Some people go running. Some people go swimming. Also, some people do yoga, do Pilates, blah, blah, blah. And you're making a shopping list. That will not impress the examiner. I know you're thinking, but Keith, it's wide vocabulary. Well, yes and no. It's wide, but it's not very deep. And in part 3, you need to dig deep, right? So I suggest you mention 1 or 2, maybe 3, but then take one of them and go deeper, right? So how do people keep fit? Well, I know if you're talking about older people, a lot of them like to do yoga and do Pilates. A few people go walking. Pilates, for example, has become really popular lately in England. There are even some local community centres that subsidise Pilates classes to make it accessible for the elderly, and you get huge numbers of people going to do it. I think it's because it makes them very flexible. It gives them a good posture. There's also something about community and having a social club together where they can meet other people and practice the activity or the sport together. There we go. Now that was digging deeper. A little bit deeper, but I think you get the idea, right? Let's move on to another question. Do you think people take action on information they read about in health articles? Well, again, do you think people? It depends on the people, right? So your answer could be, well, it depends. I think on the one hand, some people who've had a close shave or a close call and have fallen sick and they're a bit scared, then they are more likely, yes, to take action on something they've read. Maybe a health article that recommends a certain lifestyle or a diet that they think will help reduce the disease or the sickness that they have or that they're prone to getting. On the other hand, I think a lot of people don't pay attention to the articles they read about health. Because we're drowning in health articles. They're all over the place, left, right, and centre. And although we may get a bit excited about taking action, there's a big build-up, but then we don't do anything. So we're quite excited at the moment we're reading the article, but then later time passes, we get lazy and we don't take action. So I think in many cases people don't take action at all. Right. Now, so you can talk about the yes and the no. I think it is interesting that if you've noticed, we are literally drowning in health articles, right? I mean, on the internet, there are health blogs, fitness blogs, and very often we don't know which ones are reliable. And if we're not sure the information is correct, then we're not going to follow the advice, right? We're not going to take action. And I think that's a problem. There is also the idea I mentioned that there's a big build-up. There's a lot of hype around, for example, a new superfood. Suddenly, the pear is the big superfood that everybody wants to eat, and it's becoming fashionable. It's all the rage. And so people want to buy it, but a bit like a New Year's resolution, a week later, the honeymoon effect has worn off. The excitement has died down and people don't follow through. They don't carry on eating it. So I think in a lot of cases we don't take action on the articles that we read, especially about health and fitness. Right, great. Let's move on to another question. Is it easier to live a healthy lifestyle compared to the past? Right. My approach with this question is to talk about the past and then talk about the present. For example, in the past, physical activity was not so widespread. We also had fewer facilities to work out. There weren't that many gyms or outdoor gyms where you could practice sport. There was also a lot less hype about nutrition. We didn't have the internet, so we weren't drowning in these health and fitness articles. And what's more, a lot of people had quite strenuous jobs. There was a lot more physical activity. For example, people working in the factories would often have to do a lot more physical labor than they do nowadays. Nowadays, things have changed. And we lead a much more sedentary lifestyle. Lots of people are sat at their desks looking at computers, all day. And so they're not doing any activity. What's more, there's a heightened awareness around nutrition and health with public campaigns and lots of blogs and information. People are more aware of the need to live a healthier lifestyle. There's been, a plethora of gyms have cropped up around the cities. It's just so easy and accessible to go down to the gym and to work out. So I think nowadays, for sure, it's a lot easier to keep fit and maintain a healthy lifestyle. Great. I love that. So it was a nice structure, right? We had in the past. Now things have changed. Or if you want to really boost your grammar, now things have been changing in recent years. And today it looks like this. Okay. In your test, you don't need to do this. Yeah. Don't do the actions, just do the talking. I do that because I'm a teacher. I have to show with my hands, speak with gestures. Right, so lots of things we can talk about there. Some nice language, right? Okay, we're going to move on to slightly more complex and abstract questions. Do you think health services should be free? And why? Oh my. Well, first of all, you need to get an opinion. And this is quite hard. If you find a part 3 question where you go, oh my, I don't know, then just take the question, copy it, paste it into Google and see what comes up. If they come up with IELTS model answers, ignore most of those because you don't know which ones are good and which ones are bad. Look for other information, maybe government websites or private websites talking about this issue, health services, and you'll be amazed at what comes up. Okay, give you some ideas at least. So, with this question, should health services be free? In many countries, I think health services are free, right? In particular, in socialist countries, where there's a sense of community and society and making sure there's free education, free health for everybody. So the advantage is that if health is free, then it's accessible for everybody. And you guarantee no matter who is sick, they are able to access a doctor, a medicine, and basic healthcare treatment. So it's really important. I think, yes, in that respect, they should be free. At the same time, many countries have a dual system. They'll have public health and private health systems. The private health system is also good because it does give people a choice. If people don't want to wait for months for an operation, they can choose to go private and get maybe a more one-to-one personalized healthcare, a faster service. Of course, you pay for that. It's more expensive, so it's not accessible to everybody. But for those who can afford it, it does give them a wider choice. So maybe in that respect, it's a good idea. Some countries have health insurance schemes, which means that if you're paying the insurance or the relevant tax, then yes, you are covered. Of course, the problem is if you're not paying tax or you don't have the insurance scheme, then you're not covered. This was the case, for example, in the United States, where they had an insurance scheme and millions of people were not covered and therefore were not accessing healthcare. And I think at that time was when Obama came in with his Obamacare and decided to try and make sure that everybody got access to healthcare. Not easy to change the systems. And of course, in emerging, developing economies, it gets more complex because a lot of people in some, emerging economies, 60 to 70% of the workforce are working outside the formal economy. So they're not contributing the tax payments, so they're not covered by the health insurance and the healthcare system. That's a huge amount of people not accessing healthcare and getting the necessary treatment that they may need. So there are clearly downsides to having that kind of health insurance system. Right, that's a long answer, but hey, that's cool. You can speak maybe for up to a minute, maybe longer if the examiner lets you. Don't worry in part 3 if the examiner cuts you off. It's not a bad sign. In fact, in some ways, it's good because it means they've heard enough on that question. Boom, let's change to another one. They want to check your ability to be flexible and talk on different topics and different areas. So they will chop, interrupt, cut in quite a lot. Don't be surprised. Don't worry. It's not a bad thing, right, at all. Okay, so there are some ideas for you about healthcare services being free or being charged for. Let's move on to another question. How could healthcare services, or how could health services in your country be improved? Well, again, you may go, oh my, I don't know. What do? Paste, copy, boom, Google or Baidu or whichever search engine you use. And have a look, get some ideas. You may want to talk here about the need for more doctors and nurses. So maybe the healthcare system is understaffed. Nice word. Waiting times are always a problem. People waiting a long time either for the A&E, that's accident and emergency, the emergency unit. In England it's called A&E. Waiting times for A&E, for doctors, for specialists are often very, very long. You could talk about that. You may in your country talk about equipment, that you need better equipment, that the hospitals and the facilities are not up to par, not good enough, right? By and large, you'll probably be saying you want the government to make more investment in the healthcare system. In many countries, including England, they have cut investment in healthcare, and it's had a very detrimental impact. Right? We are understaffed. We don't have enough doctors and nurses in the UK. There's a big need to invest more in employing more staff. You may want to talk about technology. So digitalized healthcare, there's a nice word, digitalized. To digitalize, to make digital. So traditionally, everybody would have to go to see their doctor or the hospital and see the doctor one-on-one. But there is a trend now that we're digitalizing healthcare. So, for example, the doctor can treat you by video conference like this. Or the patient can send a picture. For example, they have a scratch or a rash on their hand. They can take a photo, send the photo to the doctor, and the doctor can give advice, either immediate or even prescribe medicine. Nobody needs to move. So this digitalized healthcare is a growing trend, I feel. What else? Oh, there's a nice example of that digitalized healthcare in China. Now, the Baidu search engine allows you to book online to go and see a doctor or to go to the hospital. You can book your appointment online. It's a simple step, but it's already cutting down and saving on staffing time, so improving the system. So there's a lot you could talk about. One other thing you can talk about, I've just remembered from my notes, is about the educating the general public on preventive care. So most of our money, most of the government's money is spent on solving the problem after it's happened. People get sick and then we try to treat it. But what if we prevent people getting sick? What if people take actions to avoid being sick? So there's been a big investment in the UK on preventive care, campaigns encouraging you to have an active lifestyle, eat healthy food, take care of yourself in order to prevent sickness. And that saves a lot of money for the government and improves the healthcare system. So you could also talk about that, about preventive care. You may want to go a step further if you're into this topic and talk about changing the way we think about healthcare. Because at the moment, the doctor's at the centre, everybody goes to see the doctor. But what if we took a more holistic approach and the doctor was a member of the team? And so people didn't only go to the doctor, but we rethink how healthcare works. An important part of that is preventive care. So people self-monitor and they keep a check on their own health. And as and when necessary, they go and do checkups. So, for example, in the UK, when you're 50, you go and do a cancer checkup. No matter whether you're sick or not, you go and do a checkup to help prevent and see or catch a disease like cancer before it gets too serious. So that happens. You may also talk about bringing the alternative medicine sector working more closely with the more traditional sector. So alternative medicines like Chinese medicine, homeopathy, acupuncture, working more closely with doctors to help prevent and solve health problems in the community. Those are some things you could talk about. There's a lot to talk about, right? And finally on this question, let me talk about the elephant in the room. That means the one thing that nobody's talking about. Well, I haven't talked about. You may be thinking, Keith, how can you do a video on health and not talk about the coronavirus? That's the elephant in the room. Well, so Somebody actually asked me the other day, will I be asked about the coronavirus in IELTS? The answer is no, because the IELTS questions, if you notice, are very general. They're very wide. They're never about specific things or your knowledge of things, right? They're deliberately wide. That said, you may use the coronavirus as your own example to show off your language. And this last question would be a really good example, right? How could health services in your country be improved? Well, one aspect that could be improved is international collaboration. I think if the health services in different countries worked more closely together and with the World Health Organization, we could tackle growing problems like pandemics, for example, the recent case of the coronavirus, to help mitigate the impact of such pandemics and to help improve the healthcare we can give the citizens of our country. Right? Something like that. So you could be using it as an example, but don't worry, nobody's going to ask you about the coronavirus. I would be very surprised if they did. But there you go. That's something you could talk about. WHO, World Health Organization, international collaboration, pandemics, right? We are on the brink of a pandemic. Hopefully in a year's time, we'll come back to this video and go, what's the coronavirus? I don't think we will. I think it will still be here for a long time. But we are on the brink of a pandemic. The brink, the edge, on the edge of. That's a nice word. On the brink of. Write it down. What do you mean you haven't got pen and paper? Seriously? You're studying IELTS without a pen and paper? I know. You're on the train. You're on the toilet. You're wherever. I know. So, make a mental note, right? Brink. Think of your breakfast on the edge of the table, about to fall off, right? Whatever you have for breakfast, it's on the brink. Breakfast. Think of your breakfast. Brink. It's on the brink, about to fall off. Got it? If not, go and get a pen and paper. Nice expression though. We're on the brink of a pandemic. So on that happy note, I'm sorry, but let's hope things are getting better soon. I'm going to bring this topic of health to an end, and also this video. Remember the secret, as I said at the start, it's the practice and getting the feedback. Remember our friends at Cambly who have sponsored this video. Thank you very much, guys. Go and check out Cambly. You've got some great discounts. You can start practicing. All the links are down below in the show notes. Start practicing, get some feedback, get really well prepared for IELTS. And I can't wait to see you in the next video. Thank you for joining me. Take care. Bye-bye. Health is a really wide topic and a very one. Through to April, we have two part 2 topics about health. No, we don't. We talk about keeping fit. I think what? Facilities, hype. What else did we have? I'll have to go back and listen. We're kind of drowning in health articles, and so people don't know. For example, right, scratching my nose.